Dr. Doreen 𝗏𝗓𝗃𝗃 is the
Dr. Doreen is an expert in autism.
Doreen 𝗏𝗏𝗃𝗃.
Dr. 𝗏𝗏𝗃𝗃.
Dr. Doreen 𝗏𝗏𝗃𝗃.
Dr. Doreen 𝗏𝗏𝗃𝗃 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Yes. Now, Johanny had written in and said, Dr. Doreen, my 10-year-old son was just reevaluated as required by our insurance, and we were just given an added diagnosis of dysgraphia and ADD. My concern is with the dysgraphia. The doctor said it is in his processing mentally and that handwriting and technical aids are just one piece. It is a cause of his comprehension issues. Everything I search talks about that only. We are waiting for the complete report. We had a face-to-face to review the results, and we'll have the written report next week. What do you recommend? Who are we supposed to see? Therapy, support, and thank you in advance.
Sure. So I would not be that concerned about that. We've had children who have dysgraphia and they learn to overcome it just like any other kind of motor deficit, right? So I think you do have therapy, and your team of therapists can certainly focus on this aspect. And you break it down essentially, and you will look at the motor functioning aspect of it, if there's any level of dyslexia involved in it, because sometimes it is difficult to differentiate between the two. And if there's any level of comprehension. I mean, you named some of the stuff here, Johanny, and it's basically the same as any other aspect of what you have already been through with the symptoms of autism. Break them down. The name doesn't matter. Break down the skill that is weak and strengthen it. And have your ABA team work on it and focus on it until they are able to get your child to a level where he's functioning like other kids. The ADD is difficult to give a diagnosis of ADD on its own. Essentially, that means the ADHD, but not the hyperactive type. Right? So it means the inattentive type of attention deficit people usually refer to as ADD. They shouldn't, because the name is no longer ADD, it is ADHD, and then there's 3 types. So there's the hyperactive type, the inattentive type, and the combined type. So my assumption is that someone is giving you a diagnosis and saying your child has a difficult time paying attention, but they're not hyperactive. So that's the one I would focus on more, honestly, because that has to do with being able to, and that'll help the mental processing aspect of things that you're worried about as well, which is, it's more about all the things you can do to improve attention. And now we're talking about things like sustained attention. So that means paying attention to something for a period of time that's longer than what we're comfortable with. So that you shape up gradually, right? And you can start with topics that the child is interested in, and then gradually increase the duration of time and ask questions about it. And then you can work on topics that the child's not interested in, and you'll see that's a much lower baseline. Usually we don't pay attention to things we're not interested in, and try to increase that gradually and reward it. Then there's like divided attention, which basically means that I am watching TV and there's something going on in the kitchen, and I should be able to continue to watch TV, but kind of have an idea of what's going on in the kitchen as well. So when someone asks me questions about it, I can say, yeah, this is what's happening here, and I also know that so-and-so's in the kitchen doing something. I think they're cooking. You should be able to have that. And then you also want to have the ability to set shift. We've talked about set shifting quite a bit. And this is the ability to go back and forth between multiple different things. Like here on this show, we go back and forth. We change the subject based on the questions that come, but that's all one thing, right? It's one form of thing. Now, if I was so that's one form of set shifting, because I have to stop thinking about Parker's question and then pay attention to Johanny's question, and then that is a form of set shifting. But the more kind of difficult form of set shifting is being able to switch between two different modalities of our brain functioning, right? So as I've mentioned before, a good way to test this is having your child go, like you take a piece of paper and you write out on the paper A, B, C, D, E, that kind of thing, and then also scatter 1, 2, 3, 4 numbers, right? And then you ask your child to go from 1 to A, to draw a line, 1A, 2B, 3C. That's a very hard exercise, and that's something that you can practice with your child if they have a difficult time with it. That helps a lot with set shifting. Another thing that you can do is this test called 𝗔𝗕𝗢𝗨𝗧, which is kind of interesting, and whoever did this testing can also administer that test, which is, a lot of you may have seen, it's the test that gives you colors, the names of colors, but in different colors. So in other words, first you'll have the words blue, yellow, green, red, and the blue is written in blue, the yellow is written in yellow, the word green is written in green, and so on. And then as you go down the lines, those change. So now you have a blue written in red, yellow written in green, and so on. And now you ask the child, tell me the colors, or read the colors. You know, those types of things help us control what we are paying attention to. Another really good way to do this is those things where you have a whole page of stuff. What is it called? Find Waldo.
A word search?
No, word searches help too.
The ones where it's where's Waldo?
Where's Waldo, right. Where you have to find something. That helps sustain attention too, because you have to keep looking at something in detail. Those types of mind activities really help with attention. Tracking an object and being able to indicate that you see the object as it moves is also an exercise. There's a lot of exercises. You can actually look these up. What are some exercises that will help attention? And there's tons of them
There's
online.
games that you can get apps that are games. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.